Welcome to the Financial Flossing Podcast with Ross Brannan, guiding dental professionals to a brighter future. Ross Brannan is a financial advisor who knows it's not just about your teeth. He helps dental practice owners protect and maximize today's cash flow to plan for tomorrow's cash needs. Find him at rossbrannan.com. On the show, he brings together experts to help dental professionals looking to make smart money decisions to grow their income, turn their retirement goals into reality, and improve their lives. And now, here's your host, Ross Brannan.
Welcome to the show. My guest today is Dr. James Woller. Dr. Woller is with Litvak and Woller Aesthetic Comprehensive Dentistry and believes in relationship-based teamwork approach to dentistry. Before Dr. Woller earned his Doctorate of Dental Surgery degree from the University of Colorado, he served the 10th Mountain Division in the United States Army. He comes from a line of dentists, and he has a very unique story. Dr. Woller, welcome to the show.
Well, thanks for having me, Ross. Been looking forward to this.
So you have a really unique entrance into the dental world. Tell us a little bit about how you got here.
Yeah. So as you mentioned, my dad was a dentist. So I kind of grew up in that world. And being obstinate, I guess, I wanted to try other things. So in college, kind of fell prey to the U.S. Army, ROTC, dabbled into that, and then ended up serving with the 10th Mountain Division for a couple of years.
And real quick, for those who don't know the military, describe the 10th Mountain Division and what they do.
Oh, sure. So 10th Mountain Division is basically light infantry. So when you need boots on the ground, that's one of the most deployed units in the whole Army. So, right when I got there, I dropped my stuff off at Fort Drum, which is our headquarters, and then I went over to Kosovo. And then later they sent me down to Afghanistan, and 10th Mountain Division has been all over the world. So it's a very active unit.
So how many years were you in the Army?
I just did the 4 years to kind of cover the ROTC commitment. So 4 years active duty as a Signal Corps officer. So that put me in charge of communication mostly. So we were kind of like mobile AT&T for the Army.
And did you see live combat?
I did not. No, I was blessed enough to not. We got a couple shells here and there when we were in Afghanistan, but no, everybody I left with came back, and I'm just fine with that.
And after the Army, what was your next move?
So after the Army, I felt like I needed a little bit more adventure. So I became a commercial pilot. So I got my pilot's license, became a flight instructor, did that for a while, and then got hired on a commercial airline. And I was flying CRJs, which if you're not familiar with those are the uncomfortable jets that are 2 rows and 2 rows in the back, kind of the smaller ones that you would fly on shorter flights, but they're fun to fly.
And so from there, you were a pilot, you'd done the Army thing, you were a pilot, and then the dentistry just started calling. Is that what happened?
Yeah, I guess that's it. So my wife and I had our first kid, and my wife works full time, and being a pilot, I was gone 5 or 6 days a week. And I wanted to be around and be more involved in my children's lives. So I decided to give up the flying and pursue a career that would give me kind of flexibility to be around. And one point I just sat down, I thought, what if dentistry does fit? So I actually started shadowing a couple of dentists in the Denver area and really liked what I saw. I love working with my hands. I love talking to people, and it just seemed like it would be a good fit for me career-wise.
And so when you got out of dental school and joined the practice, how old were you?
I was, I believe, 42 when I graduated dental school.
Okay, so you were the old guy. You were the grandpa in the class then, huh?
I was certainly the grandpa with 2 kids because we had a daughter, in between the first and second. Yeah, so I was kind of the elder statesman in the dental school class.
And so I'm sure that was an interesting experience. So, and now, did you start a practice right away? Did you join a practice? What was your move there?
So I joined a group practice that's very highly regarded in the Denver area. And it was kind of one of these things where my focus was finding the right dentist to work with because I wanted to make sure that I was a good dentist and be able to focus on patients. So I didn't want to go the corporate route. I wanted to go something that was a little bit more patient focused. What I did not do is I did not take care of my financials very well. So I loved the people I worked with. The practice was great. I just wasn't making any money, which made it hard to pay student loans, which made it hard to contribute to the family. So I had to changed things up after that practice. And that practice is still around, and they're still doing great dentistry there.
And so you then went to another practice, and now you're part owner of that practice, correct?
Yeah. So I ran into actually one of my faculty from Colorado School of Dental Medicine down at Spear. And we started a mentor-mentee kind of relationship. And then one day he invited me to join him in his practice. And I leapt at that chance.
Oh, that's exciting. So tell me you guys have a little bit of a different focus. I mean, you're not the only ones who do this, but you kind of go down a little bit of the sleep apnea side or the sleep dentistry side of the world. So talk a little bit about your practice and, how it's normal dentistry, quote unquote, and then you add the sleep apnea treatment to that.
That's a good question. So our philosophy in our practice is we want to be comprehensive care, which means, we're not treating, 32 individual teeth that happen to be attached to a body. We want to treat the person. And what that means to me is that whatever I can do to increase your health span, make you a healthier person within my ability, that's what I want to focus on. So for me, sleep apnea became a big part of that because I realized that it affects so much of what we see in dentistry, but it also affects, overall health, maybe even more so than a lot of bread and butter dentistry does.
Yeah, it's really interesting because you see a lot of people with sleep apnea. People many times think it's just really heavy, obese people, and it's not just them. I've met people who look relatively fit who have it, and we talked a little bit offline about the book Breathe by James Nestor, and it's interesting. Ever since I read that book, I've started wearing mouth tape, and you've read that book, and you were saying earlier how mouth breathing has a lot to do with these challenges that people have.
Yeah, and that book is tremendous. If anybody hasn't read it, highly recommend. Because it's not just sleep apnea, right? Mouth breathing is just an unhealthier way to breathe in general. And you see a lot of people breathing through their mouth because it's, a lot of times it's easier than breathing through the nose. But we get such better quality of breath when we do nose breathe. We're mammals and we're meant to be breathing in and out of our nose, 90% of the time. And we're not actually
natural filtration system.
Exactly. So, in this last couple of years dealing with COVID and the pandemic and everything, the first line of defense is your natural filtration and the mucus that you get from breathing through your nose. Plus, it keeps your immune system a lot healthier when you're doing it that way because you're not getting all the dust and particles into your body, and your immune system can focus on more pathogenic particles that are in the air.
So you're treating a patient. How do you know they have sleep apnea? Or how does that conversation come up? Or is it, hey, we offer sleep treatment and people approach you about it? How does that work?
Both ways. So we get people coming into the practice sometimes just because, their doctors recommended a CPAP and they don't want to do it, or there's a wait list to get on a CPAP and, they get referred over to see us for alternative therapy. But I'd say most of the time we do a very thorough, our new patient exam is an hour and a half long. So we do a very thorough new patient exam. And we look for signs, we look for long palates and scallop tongues and posterior wear and abfraction lesions and kind of put the whole picture together. And you're absolutely right. The body type for sleep apnea, there's no one specific type. So some people, it's an easy conversation. Some people, there's a little bit more convincing you need to do to get them into a sleep study.
Interesting. Now, besides sleep apnea, I mean, how open are people to that? Because how many people are like, wait, you're a dentist. Why are you talking about sleep apnea?
Yeah, I get that question a lot. And people are much more open to investigating sleep pathology when they realize it's not a CPAP death sentence. I think there's a lot of people that just know about that treatment and absolutely don't want to do it or know they can't tolerate, sleeping with a mask on their face. So rather than find out what's wrong with them, they just ignore it because that's the only treatment that they're aware of.
What type of treatment do you give people?
Well, it depends on their level of disease. So like we were kind of talking offline, if we got somebody that's, mild or even mild to moderate, we're going to start with some behavioral adaptations first before we get into any, medical device or anything like that. So the mouth taping, that's absolutely the first step. A lot of times, I've got some patients that only have sleep apnea if they're sleeping on their back. So There's different devices like a shirt with a tennis ball sewn into it to prevent you from sleeping on your back and you stay on your side. And, that can be curative of sleep apnea, just changing the way you sleep. So I always start simple and I work my way up. But to answer your question, in the dental world, we have that the mandibular advancement devices, the main treatment of the symptoms of sleep apnea.
But sleep apnea opens the door to other things then, doesn't it?
Yeah, absolutely. Because it has, like I said, it affects everything we do in dentistry. It creates an acidic environment in the mouth. So we get a lot more dental caries. We get a lot more wear, abfraction lesions. So before we start, fixing the teeth and doing that, I like to get to the root cause. And if we can minimize or fix the sleep apnea problem, it makes, treating the teeth and the rest of the problems a lot more predictable and a lot more long lasting.
Now, talk about TMJ and teeth grinding, because are those symptoms of sleep apnea, or does that fall in the same realm?
It does fall in the same realm, especially if we're talking about the mandibular advancement, because you can't ignore the TMJs when you're putting the jaw into a different position, especially for, let's say 8 hours every night. So you have to look at the TMJs to see if there's disease, if there's not disease. And we treat people with, TMD all the time, but we want to know the risk before getting into the treatment. But yeah, clenching and grinding, nighttime bruxism is often a symptom of sleep apnea, but not always. So I always want to be careful about promising too much when we're treating sleep apnea.
And what kind of results do you see with sleep apnea? I'm assuming some people, it's a, hey, you got to lose weight type of scenario. But how many of them do you see success and progress with?
So I'd say you got to define success. So with a mandibular advancement, we're not going to get, if you come in with a, moderate to severe sleep apnea, we're not going to get you down into like an AHI of, 1 or 5 down in that very mild or no sleep apnea range. But we see improvement in probably, I'd say 85, 90% of the people that go into a device. Some people, as soon as they try it on, they can't sleep without it ever again. Some people don't really tolerate it very well, or they see marked improvement and we get their oxygen saturation level better, but they still might not be sleeping great, which again, before we start treatment, I always let them know we're treating the breathing problem. It's not necessarily going to make you, have better sleep. Oftentimes it does, but not always.
Interesting. What's the, I guess it's such a unique thing. What's one of the kind of more out there things that you've seen doing this sleep dentistry?
Well, the trend nowadays is looking to cure sleep apnea rather than treat the symptoms. So I said, positioning the mandible forward at night is a way to treat the symptom of sleep apnea. But if we're looking to cure it, really, we need to undo, a couple of generations of industrial revolution and chewing. And what I mean by that is humans don't grow wide as they used to because we're eating a mushy diet, starting as a baby, and we just don't get the bone structure.
Breathe.
Yeah, it does. It does. And, that's right on the science. So treatment today to fix that, we're doing something called surgically facilitated orthodontic treatment, where there's a combination of, augmenting the bone and expanding the jaw so that we can get, people wider and open up the nasal passages and get more volume for airway space.
And so is it surgery, or is it more just kind of like an orthodontic procedure?
So that involves surgery, because if you just try to do orthodontics, a lot of times you'll tip the teeth, or you'll push the roots of the teeth outside that buccal plate. And the buccal plate is kind of an immovable structure in our mouths. But if we damage the buccal plate with surgery, so you go in and cut grooves into it, now your body is remodeling that. So as we expand it while you're remodeling your buccal plate, we can actually move your structures without pushing the roots outside of it. So you do need a combination of the surgery and the orthodontics. Otherwise, you risk kind of pushing teeth too far to where your body can't remodel.
How many people go down that road?
Very few.
Does that change the way they look?
It does. I mean, for the most part, it actually improves aesthetics because, you get that wider, fuller smile where your teeth, it's easier to align them. So the aesthetics are usually improved after something like that. But it's a pretty involved surgery to do that. So the recovery is not very fun. You're on a soft food diet for, quite a few weeks, and it's kind of hard to go through. But we don't have bad outcomes with that, but it's, you got to be committed to it to want to sign up for that.
Yeah, that's definitely serious right there. But I mean, someone who does that, is that just because they're having that much trouble sleeping?
Or they're, really crowded and constricted. And, one thing is they might want to do it for the aesthetics as well as the sleeping. One is, they may prefer to do something like that than to be living with a CPAP or a mandibular advancement device, or Inspire as a new way to treat it. But if you don't want to live with one of the treatments for the symptoms of sleep apnea, that's a way to cure it.
Wow, that's really interesting. What are some things that have surprised you that you've learned doing sleep treatment?
Some of the things that surprised me, the biggest things, is how it affects everything that we do in dentistry. If somebody has sleep apnea, you just learn to start seeing it. You go from seeing the people that you can hear breathe coming down the hallway to, as soon as they open your mouth, you start thinking sleep apnea. And that's, like I said, if somebody's got a lot of erosion and wear on their teeth, and especially if they've got that scalloped tongue, meaning their tongue's been pushing against their teeth for years and years and years. And honestly, we see this a lot more on kind of younger, fit women who you wouldn't think have sleep apnea. And those are the discussions I said that are kind of harder to get them into sleep studies. Although women are generally, can be more attuned to taking care of themselves than men. But I think that's a population that's oftentimes missed.
Really, that's really interesting. So, because you really, like we said before, I've seen fit people who have sleep apnea, but it's typically, in my experience, and I don't deal in sleep treatment, heavier people. But you're seeing, it's definitely heavy people, but there's a lot of people who aren't heavy who have it. It's not just a little bit, it's a lot.
Correct. Yeah. So, and sleep apnea it's a progressive disease. It gets worse as we age. And really it's about, structures that are going to impede the airway. And as you get heavier, your visceral fat kind of pushes on those structures. So that absolutely adds to your risk factors. But, you don't have to be a big, heavy person to have a palate that, extends too far down into your pharynx, or have a tongue that's too big for a narrow archway kind of thing.
Wow. Wow, that's really, really interesting. So where do you see the future of sleep dentistry going?
I actually see the future of sleep dentistry going away from the mandibular advancement device. It's an easy fix, but it does, it's got its own implications when you're repositioning the jaw. You can change the bite. If somebody does have TMD, you can exacerbate that. I think that, the latest and greatest for treating the symptoms is probably the Inspire Sleep implant, which is like a hypoglossal nerve implant that makes you stick your tongue out when you inhale. But again, that's a surgery where you're having an implant put into your body, and not a lot of people like to do that. But I think in order to really affect change, we need to look younger and younger and younger. And if we know that part of the cause is having a soft and mushy diet, if we can counsel parents and get toddlers and even infants, instead of putting them on rice cereal and then mushy baby food, get them chewing on beef jerky or nuts or raw carrots. And there's devices that we have to keep infants from choking on things like that, but get them using and working their jaws and trying to build more muscle that's going to create bigger, wider structures. That's really where I see the future is we need to go younger and younger and affect growth while we can to avoid sleep apnea as adults.
Yeah, that's really, really fascinating. Well, so as we wind down here, what would you recommend to a dentist who has never really gone down the sleep dentistry road, but is really kind of intrigued or interested by that?
So first and foremost, pick up Breathe by James Nestor. Absolutely read that. And then, the ADA, it's our job to at least screen for sleep apnea. If you don't want to treat it, and a lot of dentists don't want to treat it because of the side effects and, getting into it, and there's 100 different appliances to choose from. So it gets complicated. But you need to look for the signs and symptoms so that you can get your patient referred to an ENT or a sleep specialist, at least get them started on the path so that they're aware of a disease. So I'd say at a minimum, look at the American Academy of Sleep Dentistry and look at, some things that you can incorporate into your exam. And they're very easy things to look for. It doesn't add any extra time to even a quick and simple periodic exam. You can look for some of those signs and symptoms just to make people aware and get them started on that path.
Yeah, that's really interesting right there. So, well, James, this has been a really fascinating conversation. Quite frankly, I've been fairly naive on this. I've known about it, but I haven't actually dug into it. And this has been really informative. I really appreciate your time here today.
Well, great. I appreciate you having me on, Ross. It's been a real pleasure. And as you can tell, I could talk about sleep and dentistry for hours.
You've been listening to the Financial Flossing Podcast with Ross Brannan.
This has been another episode of Financial Flossing with Ross Brannan, guiding dental professionals to a brighter future. If you liked what you heard, consider subscribing wherever you listen to podcasts. For more on Ross Brannan, visit rossbrannan.com.
This podcast is for informational purposes only. Guest speakers and their firms are not affiliated with or endorsed by PAS, Guardian, or North Florida Financial, and opinions stated are their own. Ross is a registered representative and financial advisor of Park Avenue Securities, LLC, PAS. OSJ 3664, Coolidge Court, Tallahassee, Florida, 32311. 850-562-9075. Securities products and advisory services offered through PAS. Member FINRA, SIPC. Financial representative of the Guardian Life Insurance Company of America. Guardian, New York. New York, PAS is a wholly owned subsidiary of Guardian. North Florida Financial is not an affiliate or subsidiary of PAS or Guardian. Arkansas Insurance License Number 161390032. California Insurance License Number 0L10073. 2022-142673 expires 8/24.